Colic is a condition that we see quite commonly in horses. It basically means a bellyache or pain in the abdomen, and horses tend to have a very low tolerance to abdominal pain. Some of the most common causes of colic are sudden changes in diet, introduction of new feed, consumption of a large amount of grain, engorgement on fresh grass, parasites, and especially in the warmer months, inadequate intake of water where they become dried out and impacted. Signs of colic usually are horses restless, patchy sweating, maybe wanting to get up and down, pawing at the ground, kicking or looking round at its belly, occasionally even straining. In the event of colic, it's probably best not to sit and wait all day. The sooner it's seen by a vet, it can determine the exact cause and whether colics fall into two main categories, either medical or surgical. Medical and surgical colic, the most common one that we see, and by far the largest percentage, are medical, and which are just really a mild disturbance in the gut motility and usually respond to medication, whereas colic, a piece of the gut has become compromised or trapped in a location it shouldn't, and that involves surgical intervention and colic surgery. If you suspect colic, the best course of action is to have it seen by a veterinarian as soon as possible. The reason for this is obviously to prevent undue suffering, but more importantly, if it is a surgical colic, that it can be referred to a surgical facility before it is severely metabolically compromised. Bringing the horse in with colic, it gives us access to a range of diagnostics, including abdominal ultrasound. Also allows us to put them on fluids if that's required, or in the event of them being surgical, we can assess them and refer them to a surgical facility with an accurate diagnosis.